Good evening, everyone. My name is Leonardo Figueroa, and today we're going to go briefly on how to do a hand x-ray. This is something that I do day to day on my job. I'm an x-ray tech for 3 years in the United States Army right now. I'm currently stationed here in Fort Jackson, South Carolina in Moncrief Army Health Clinic. So as you can see here, we have a CR cassette, which is used to capture the image of the anatomy for whatever you're taking a picture of. So in this case, we're going to be doing a quick demonstration of taking an image of someone's hand. Here we have our tube head, which emits the radiation, and we have our little light. Our light is what actually is our light field, is what captures our image. So we're going to go over 3 different views. Our AP hand, our PA hand, our oblique hand, and our lateral. These are 3 views that are demonstrated for a regular diagnostic hand x-ray. So the first one I'm going to show you guys is the PA hand. The PA hand will start by you getting the cassette. Make sure the cassette is nice and aligned with the light field, so that your image is not miscued or rotated in a odd way. So whenever the person reading the image, it's nice and demonstrated as it's seen like this. So first you would get the patient's hand and you will place it down. You don't want them spider webbing their hand, so you would place it nice and down. As this light field has kind of a crosshair, you want the center of your hand right here to fall right here inside the crosshair. And then you would mark it with the left, with a little marker that has an L, or a little marker that has an R for right. That's so when the radiologist reads the image, they're able to interpret which side is being demonstrated. As sometimes things can be miscued and mismarked, and that's something you don't want. You don't want someone to have a misread, exam. So for a simple PA x-ray, it's simply you put the hand down right there, make sure everything's lined up. The light field demonstrates from the tip of the fingers. Make sure all the fingers are in the light field, just a little bit past the small little notch right here, which is called your styloid process. You want to go right there, so make sure you have all the carpal bones and all your phalanges as well, and your metacarpals, just so it can demonstrate the full hand. That is our first image. The second image will be your oblique, which is just rotated about 45 degrees. So the reason we do multiple images is for the fact that, per se, if I had a fracture somewhere around right here, and if I only shot one image, which is my PA, sometimes you won't be able to see that. You see it and it looks perfectly normal. So when I would do an oblique, you would just simply rotate the patient's hand about 45 degrees. In some instances, if someone's hands are jittery or they can't hold it still, you can simply use a little sponge, a translucent, radiolucent sponge, which they just kind of lay it right there, and there you go. You have your oblique hand. So this will demonstrate more the angulation going between the hands and the fingers. So in here you can see things like spiral fractures and stuff like that is not easily demonstrated or noticed in a PA. Next, for the final one, is a lateral hand. So a lateral hand, you'll make a nice karate chop in the light field, making sure everything's there. You would roll the wrist back just slightly, so you have your radius and ulna superimposed, stacked on top of each other, so you don't see them kind of flip-flop. You just want them completely one on top of each other. With your thumb and your pointer finger, you're going to make kind of like an OK sign, and then you would flare out these fingers, so that now all your metacarpal bones are nice and stacked and on top of each other, and then now you can individually visualize each finger spread out. As you can see, if there may be any fractures or any dislocations right here, that may not be demonstrated here or here. So you have 3 different views showing 3 different demonstrations of the hand. And it's extremely important that you have all these views to capture anything, because one image is not just sufficient. So the more images you have, the better the radiologists and doctors have to interpret it, which leads to your overall better health care. You want someone to have the most ultimate and best treatment in order to treat them and make sure they're all okay. And again, my name is Figueroa, and I just briefly went over to do a complete hand x-ray. Thank you.